Hi, I'm Dr. Lee Merritt from Enlighten Omaha, and I'm here to talk about vaginal rejuvenation. Now, vaginal tightening is the latest big hot thing in wellness for women's health. And what it really involves is shrinking the vaginal vault. What we do at Enlighten Omaha, I'm going to show you the little device. This is a little wand, and it's for radio frequency warming. And basically, this is a very gentle procedure. This is placed in the vagina, and for approximately 10 minutes, it's just put in and out in the vagina, and this little radio frequency device heats the tissue, shrinks the collagen, and thereby shrinks up the vaginal vault. Now, why do this? What's this all about? As we get older, we've had things happen. Women have babies, it stretches out the vaginal canal. Menopause, if you're not doing bioidentical hormone replacement or for whatever, aging can cause some flaccidity of the vaginal canal. And when the muscles are no longer young and tight, what happens is your urethra is not well supported and people get incontinence. Mostly it starts out as stress incontinence, which means when you cough or sneeze or jump down off a height, you can lose some urine. And so more and more women, as we get older, find themselves wearing a pad, and it's unpleasant. Now, in some people, this is so severe that there's no option other than surgery. But for many people, and I was one of them, for many people, it's a minor problem, but it's an annoying problem. So if there's a treatment that's not great, it's not worth getting a major surgery for, but if there were a non-surgical, easy treatment that would solve that problem, meaning going from wearing a pad to not wearing a pad, or at least not being as big a problem, that's something that I think women are interested in. So this is done very gently. This is the little device. It's a radio frequency wand. We usually do 2 to 3 sessions. And what it does, this hooks up to a machine that puts a little radio frequency current through the device. It warms it up, and it is just what you feel is basically a mild warming sensation. And this goes in and out for a 10 to 15 minute session. Some people we do 15 minutes twice, other people we do 10 minutes 3 times. But at the end of the 3 sessions, the collagen has been shrunk so that the vaginal vault now is tighter. Now, for years, doctors, and especially OBGYN doctors, have told their patients to do Kegel exercises, which is it's like exercising your bicep, only you exercise the vaginal muscles. That works, but it doesn't work as well when the muscles are all stretched out and flaccid. So by doing this, you give yourself a fighting chance. You tighten things down, and then the muscle exercises work better. The side effects of this are extremely rare. In tens of thousands of these studies, there were no burns and no problems with the radio frequency device. The biggest issue was with the CO2 laser. That was one way of doing this procedure. I think it's fallen out of favor to some degree. This is a very safe device. This is a totally different procedure, and it's certainly much safer than surgery. You know, I'm a surgeon, and we love to do surgery, but there is no surgery without risk. And so the less invasive the procedure, generally the less risk. And that is the point here. I think it's a very good procedure. I can tell you my own experience. Was it made a big difference to my own urinary incontinence, and I was one of the people, like I'm talking about, that it was mild enough that it didn't bother me to get surgery. But I'm happy that it's pretty much gone now.